Hello, my name is LaCee Jimenez, and this training is the Nutrition Environment Food Pantry Assessment Tool training that is for Create Better Health ambassadors and supervisors in your work to create healthy pantries. This training will overview the form and how to fill it out. It'll also include information about the objectives of the form, how to support pantries using our approved PSE Pick List, and entering the form into PEARS. The Nutrition Environment Food Pantry Assessment Tool, or NEFPAT, is a validated environmental assessment that quantifies the nutrition environment of food pantries. This is a great way for us as Create Better Health to measure how our interventions and how the work we do with pantries is helping the pantries to make healthy food choices more accessible to their clients. It was created by Illinois Extension and it is evidence-based. It has been used in journal articles and is included in the SNAP-Ed toolkit. As we do this training, it will be best if you have a copy of the NEFPAT or assessment tool during this training. So I recommend that you go to the staff website under PSE in the Thumbs Up for Healthy Choices section in order to either print or even you can follow along on your computer, but download the NEFPAT during this training. So pause and go get that. Welcome back. As you see in this form, that there are 6 objectives where the questions are broken down into 6 sections. There's also an introduction area where you collect some general information about the pantry. Another great tool that you can have, especially during the first few times that you are filling out this form, is an instructions for the NEFPAT provided by Illinois Extension. It is also on the staff website, and it is just in the Thumbs Up for Healthy Choices section along with the actual tool that you likely just downloaded or printed. Filling out the form. How do we get the answers to all of these questions? It may feel a little overwhelming. You know, we did select this form because it does seem to be a easier form to fill out compared to what we've done in the past. We hope that that is the case for all of you. As you look over the form, it's important to note that you will likely need help. You'll almost most definitely need help to fill it out, and you need to be in contact with your local food pantry where you hope to implement policy, system, and environment change. You can be working with the director or with one of the staff members or volunteers who know enough to be able to provide answers to some of these questions. When you go to talk with a food pantry, please make sure to note that the assessment tool is to measure our work more than their work. We aren't regulators. We aren't there to give them a grade or to check up on the food pantries. Really, this tool is to help us identify opportunities where SNAP-Ed could help the food pantry and support their work. But it's also a way for us to measure how well we are doing with our interventions. So please make sure to let the pantries know that the reason we do this assessment is to help us know how we can help and to measure if our help is working. We recommend also that you should observe first and then ask. It is best to first make an appointment to visit the pantry right before or during an actual food distribution. That way you can get a feel for what it's like for the clients who go to the pantry. You can observe how the setup is, how the whole transaction occurs, and make notes and answer the different assessment questions on your own. For the questions that you cannot answer on your own, then go to the food pantry director or your contact there to answer those questions. And you'll notice that the creators of the assessment tool did, through focus group and other kind of research in creating the tool, they did identify questions that possibly or likely you may need help from the pantry staff to answer. So those are all marked with an asterisk inside the assessment tool. A term that's used frequently in the tool is F2E, or foods to encourage. These are the same as the thumbs up for healthy choices foods that are in the thumbs up toolkit. In fact, Casey Coombs, who developed the thumbs up toolkit, used the same source of information, the Foods to Encourage from Feeding America, to create the standards for thumbs up for healthy choices. So as you see F2E, just for your information, that is the same as our healthy choices foods. And please remember that the foods need to meet all the requirements for their specific category within the Foods to Encourage or Thumbs Up foods to qualify. And there is a list within the actual assessment tool, but then you can also find this information in the Thumbs Up for Healthy Choices toolkit as well to help you as you fill this out and familiarize yourself with the healthy choice options. Here's an image of the form, as you likely see before you, with some directions, some of the things that I just covered, but reminders to help you as you fill it out. There includes information about which ambassador is filling out the form or observing the pantry, information about the pantry, your contact's name and information. It also asks for the number of individuals served per month by the food pantry. That's something that you likely will need to ask a staff member about. I think, it could be possible that you could stake out the food pantry and gather that data on your own, but it is a much better use of time to just ask. Typically, food pantries will provide this information by client or household that they've served. So just be aware that, and try to clarify when you ask how many individuals the pantry serves, just to make sure that, is it a household or are those the actual individuals? Because they may know the size of the families of the people they are serving, or they may have their own formula for determining that. If the pantry cannot provide individuals, just households, then you can calculate that on your own. The method used with the Nutrition Environment Food Pantry Assessment Tool is to use the USDA characteristics of Supplemental Nutrition Assistant Program households, and then multiply the number of people who are typically in a SNAP household in the state to the number of households that visit the food pantry. So in the case of Utah, that's 2.4. So if they serve 100 households a month, then you would have 240 people. In the circumstances where you do not get a whole number, please do not report a decimal or a fraction for a person. So just round down to the nearest whole number when you are reporting that. And what's great is that then you can have this information to add to your PEARS entry on how many people are impacted by your interventions. Once again, the asterisk will just indicate questions that you will likely need to get a little help answering. Funding and food donor information. This section is an excellent place where you may be able to learn for opportunities and potential partners for healthy food drives. You can learn if there's maybe some faith-based organizations. You could ask if maybe you could help any of those organizations by helping provide materials or doing the nudges to requesting healthier items. I think it's always important to encourage all donations to the food pantry, but we can, in a very proactive, positive way, just nudge people to say, hey, if you're choosing foods to donate to the food pantry, please consider these items: the lower sodium canned goods, the fruit and juice opposed to in heavy syrup. I think a lot of people are quite receptive and want to be helpful. And so that's just an opportunity, as you are learning the information of where the food pantry sources their foods, possible groups that you can partner with to help with healthy food drives. Objective 1 is to increase client choice for nutritious options. This has probably been quite impacted due to the COVID-19 pandemic, and that's unfortunate. I feel that there's quite considerable research that suggests that being able to allow clients to choose some of their options at the food pantry is really empowering, as well as beneficial to helping them make healthy choices and to choose food that won't be wasted, foods that they like and enjoy. So as you go through the pantry, you can notice if clients are able to choose which types of the foods to encourage they'd like to take. Maybe they're allowed to choose 2 different options of the fresh fruits or vegetables. And so they can choose a few different kinds, or maybe they're allowed to choose any of them. Does the pantry host a shopping style distribution where people are able to kind of shop as if they were in a grocery store to pick which items they would like? And this can be, and going back to number 1, it could be, even if clients aren't able to go inside the food pantry, if they're able to fill out a form or tell the volunteers that there are items that they would like to take, you can include that. The clients just aren't required to take certain F2E items and are instead provided options that could be on a certain shelf, a table, a window, or, like I said, like a menu is an option too, even if they aren't opening the pantry for people to do the shopping style. Are clients able to come to the pantry more than once per month? Does the food pantry offer items from each of the 5 food groups? Do they encourage nutritious donations from their donors? Or possibly ask donors to not provide certain foods? Is the food pantry listed on ampleharvest.org? And while this has an asterisk, you could actually look this up on your own at ampleharvest.org. You can go there and just search for a participating food pantry based on your zip code to see if the pantry is listed. And then also you can see if the pantry has an established nutrition policy for purchasing foods for clients, as well as a policy in place for proper food safety. And for it to be a policy, it needs to be a written policy. It's an informal or verbal one will not count for this. Then you can add all the checks that you've marked, or all the boxes that you've marked for your first total for objective 1. In objective 2, this aligns very well with our thumbs up for healthy choices. It's how to market and nudge healthful products. You will see if recipes are available to clients that feature the foods to encourage or thumbs up healthy choices to the clients. It's best if these are recipes that people can take home, not something that's just like a poster to prompt ideas, but something that they can take with them, whether it's virtually or an actual paper. So they can try the recipe when they're using the food items at home. Do they offer food samples? Are there My Plate and other healthy eating signs that are promoting the healthy choices? Do they create, dinner kits or packs or bundles that feature at least one of the foods to encourage, so it can show a complete meal? Are the foods to encourage or healthy choice food items stocked so it appears that they are abundant? Are most of the healthy choices displayed or angled to be viewed easily from eye level of an average participant? Is at least one of these items visible right when a person enters the pantry area for choosing the food? You know, these are some of the strategies. You'll even see them at grocery stores. This is something that I've learned, that products are able to kind of purchase, being at eye level. There's something really powerful about being easily seen, that our behavior is to grab what's easiest to find instead of going and searching and looking. People might be in a hurry. People may feel like they want to spend as little time at the food pantry as possible. It could be whether they feel maybe a little embarrassed of being there, or it could be just because of COVID-19, only so many people can be at a time and they feel pressure to hurry and get through there. So whatever we can do to help make the easy choice the most convenient choice too will be helpful. So here you'll just add up all of the boxes that you've checked. The third objective is that the pantry provides various forms of fruits and or vegetables. As you all know, sometimes folks feel like fruits and vegetables need to be fresh to be nutritious, but we know that that isn't the case, that you can enjoy a lot of the great nutrients from fruits and vegetables in various forms. And it's great when pantries are able to provide food in those different forms. And sometimes that's something that can help address either the living circumstances, the cooking ability, and also cultural preferences that food pantry clients may have. For example, if there's a parent who is a little stressed about accepting fresh fruits and vegetables because they feel like they always go bad, frozen may be a great option. And so just having a variety of fruits and vegetables at the pantry is really helpful. And here you can see you can click for each variety. And then there's also some of the foods to encourage healthier varieties that you can match as well. Like for example, canned vegetables with lower sodium. Here you can add up the total as well for that objective. For objective 4, we're trying to measure if the food pantry provides a variety of types of fruits and vegetables. And please note that this includes any kind of form that was covered in the previous section. So, perhaps they have canned peaches. So we see peaches in the yellow-orange group. You can check that they have canned peaches. And then maybe they have fresh carrots, which would also be yellow-orange. So you could check that there are more than 2 types of the yellow and orange in the food pantry. There is a list in your assessment tool. It is not exhaustive, but it does give you just a little guidance and help if you need that in determining which color to assign a certain fruit or vegetable. The 5th objective is to promote additional resources at the food pantry. That's something that we at SNAP Ed, our role isn't to help people sign up for other resources, but we can provide referrals to the Department of Workforce Services or to let people know of different programs that may be available in their community, and then people can work with Utahns Against Hunger or other groups in order to get the help they need to sign up for those programs. It's also helpful when food pantries are providing this information to people, especially for those who may be using the food pantry for the long term, when it's not just a 1 or 2 month kind of hiccup where they will only need it for a short time. But if they're going to need it in the long term, it's very likely that it would be helpful if they aren't already receiving some sort of additional help, such as with SNAP or WIC, that they can learn about it and access it when they visit the pantry. So you can find out if the food pantry provides information on SNAP, WIC, could be Double Up Food Bucks, or other low-income resources? Also, do they provide nutrition education to clients by partnering with us? Or it could be FNEP or some other source of expertise in nutrition education. Do they promote or provide mobile markets for those who may be limited and not able to go to the actual food pantry? Do they have a garden or provide gardening resources for clients? Do they have information about Medicaid and affordable health care? It's possible they might promote or provide health screenings at the food pantry or in partnership with the health department or other organization. Do they provide employment assistance information in partnership likely with the Department of Workforce Services? And if there's any other sort of educational or self-improvement resources provided or promoted at the food pantry. And here you can add up those boxes once again for objective 5. Finally, objective 6 is for planning for alternate eating patterns. So this is just a way to help encourage pantries or keep on their radar the importance of being inclusive as much as they can. It definitely can be limiting. You do have to work with what you receive in regards to food donations. But actually, in one of these pictures, I know Selena Willie, our director over Latino programming, worked with a local food pantry in order to procure foods that were culturally appropriate for Latino families in Cache County. And so there's definitely opportunities that we could do healthy food drives, but even healthy and culturally diverse food drives. So with the boxes, does the pantry provide pantry volunteers with nutrition education? And that can be an opportunity for us to make our programming more sustainable. If the pantries are aware of what the foods to encourage are or the healthy choices, if they understand how to use My Plate and create better health with the CREATES concepts, they can pass that on to their clients. And they'll be able to implement some of our strategies more independently with just technical assistance from SNAP-Ed. And then that will actually free you up to be able to reach more pantries as a county. You can see if they use the Commodity Supplemental Food Program that provides food tailored for low-income elderly clients. Do they have a labeled section for specific foods such as gluten-free, dairy-free, low sodium, vegetarian? No prep required. I know some pantries, especially when they work with maybe a homeless population that just doesn't have access to hardly any tools, kind of ready to eat foods that they can just open up the can and eat from, are helpful and what the clients are hoping and looking for. Also, do they provide diverse options for protein beyond animal-based options? Is there fish, peanut butter, beans? I think usually beans tend to be available at pantries, and sometimes it's even maybe the diverse option would be having animal-based meats available to their clients. So just providing a diverse option is beneficial and important for being able to reach a multiple populations. Also, do they provide culturally diverse food? And like I said, our Latino programming team with Paola, they can help in identifying what kinds of foods would be more appropriate for Latinx families. And I also know that our Salt Lake team in particular has worked a bit with recognizing foods that are appropriate for halal and other culturally diverse foods. So we can definitely help and support you if that becomes an item that the food pantry would like more help with healthy food drives. Then you add the total to the box here and add them all up and you're done. And as we've gone through, I think you probably notice, as I've also pointed out, that there are a lot of opportunities to match some of these points in the objectives to some of the PSE Pick List projects that we have for Create Healthy Pantries. There are healthy food drives. You know, I think if the pantry maybe doesn't have a very diverse selection of colors of fruits and vegetables, that buy produce for your neighbor or the community gardens would be great options to support that. If they need a little more help with nudging folks to use the healthier choices, maybe they have them, but people just aren't picking them, then you can look at some of the strategies with Thumbs Up for healthy choices in the food pantries and providing recipes. And, you know, our nutrition education to the clients is also a great way to help with that. If there's something that you'd like to do that falls outside of the PSE Pick List, please reach out to us. We do have a form where each county can request a different project from the pick list. We just have to make sure that it aligns with what we've been approved to do by the Department of Workforce Services and the Food and Nutrition Services from the USDA according to our grant proposal. But we are happy to work with you to determine if your different idea would work. Entering the NEFPAT into PEARS. So from here, I will change my screens to share PEARS with you. So here I created Ashley Valley Food Pantry sample project. So you just fill out your entry as usual. When you get to the needs, readiness, and effectiveness section, here's where you can add an assessment. So what you'll see first is, did you conduct any needs or readiness assessments at this site or organization during the current reporting year? And you'll click yes. You'll add the assessment. And here you'll see that I've added one just for our practice. The first item you'll select is needs assessment environmental scan. Then on the drop-down list, you'll find nutrition environment food pantry assessment tool. For our tool, you'll add the date of when you administered the baseline assessment. And here you can add a description or notes on what your results were, things that you think are really important to help guide you with programming and that we definitely should know at the state office and, you know, above us at DWS and the other organizations of what the work is you're doing and what the circumstances are at the pantry at the beginning of your project. You add your assessment score here, and then you can actually come back to this. So just like before, you'll see that I have this here. Let's say that I went back and after my baseline, I did my intervention and it's September, and now I'm going to add my baseline or my follow-up, my follow-up score. I'll add a date for the follow-up, a description of the results, and then that final score, save it, and that's it. In the general information section, you may also upload, and actually I would recommend that you do scan and upload or take pictures of and upload your form. That way, if you have any notes and things that we can see, we can get the most complete picture of the assessment tool of your assessment that you made with the tool. And that can help, especially if for some reason maybe there's a new ambassador that's going to take over the project or a new supervisor. They'll just be able to see everything in one place, which is really helpful. Also, as you go and you do your intervention, I just want to point out that this comment section, while optional, is pure gold for the state office. If you're able to keep that updated every time you visit, just give a really concise information about what you've done when you've gone to visit the pantry. That helps us just to have a better feel for the work that's going on. And it can also help us identify opportunities that we need to do more to help you, or opportunities to celebrate you, to see the amazing things you're doing. You know, I often get really impressed when I can see the comments of the work that you all are doing. If you have any questions, please be sure to to ask. I'm more than happy to help if you have any questions concerning PEARS or how to enter your assessment into PEARS, or really anything about PSE work. That's what I'm here to do, is to help you all. Here is my email, and yeah, I am really happy when I get to learn about the work you're doing and to find ways to creatively help pantries be able to make the healthy choice, the easy choice, the convenient choice, the best choice for our participants, and to really make it an experience that's positive for their clients and for the food pantries who partner with us. So please reach out, and also please, just so you know, it is so important for us to be able to demonstrate how our work is making an impact. And that's why it's so important that you all do your best and all reasonable efforts to fill out these assessment tools each year. And if you fill it out at the end of the year, in September, your follow-up score, if you are doing programming throughout the whole year, you can use that baseline score from September as your follow-up score from the end of the year as your baseline score for the upcoming SNAP-Ed year in October. If you do happen to take several months off, you can assess if the pantry's made any changes. Then you should do a new baseline assessment. If they haven't had anything change since the last time you did the baseline, then you could still use that baseline again. But thank you so much. Please reach out to me once again if you have questions, and I hope you have a wonderful day, and good luck with all your programming to create healthy pantries. Thank you. Goodbye.